Well, welcome to the Tooth Tips Workshop today. I'm excited to be here. Hope you guys are as well. Hope you guys can learn some things together as we spend some time learning together. Just a little bit about who we are. Before we do that, I just want to go over some introduction on kind of what the workshop's about. We are Tooth Tips for Kids. We are an organization that worked with different organizations as well to help kids in the local area of Mesa, Arizona, in helping them fight tooth decay. And sometimes we'll put these workshops together to help kids and parents of kids to learn how they can better take care of their teeth. We're here to educate. We're here to have an interactive learning experience, which you'll soon see here in a little bit, and hopefully help you guys make some healthy changes within your life and with your kids' lives. And so, just a basic layout of what we're going to be doing. We're going to do three different points here on our workshop. One's going to be about brushing techniques. The next is visiting the dentist, and third is diet and sugar. And then we'll conclude and kind of wrap up our workshop today. So hopefully you guys will be able to set some goals here at the end when we're all done. So let's talk about brushing techniques real quick. So how old should you be to start brushing your teeth? Well, they say that as soon as you start seeing teeth, you can start brushing them. They say at 18 months, you can actually use a small amount of low fluoride toothpaste to help with the brushing there. So you can start pretty much as soon as you start seeing teeth. So you shouldn't stop, or you shouldn't wait. You can start doing it now, and it's good for kids to get in the habit of it. I want to go briefly over some of the do's and the don'ts of brushing, and let's go over the do's first. So do brush with fluoride toothpaste. Do choose the right toothbrush. You want to have a good toothbrush as far as firmness. Some like a really firm toothbrush, but that's not always the best choice, as it can cause, it can't be the best. It's not the best for your gums when you're brushing with a firm brush. You probably want a medium or a light. Do brush for at least 2 minutes. There's 4 quadrants in your mouth, top to bottom, left and right, and those should be at least 30 seconds for each quadrant, which would equal 2 minutes total. Do replace your toothbrush often. This is just good overall, as far as the usefulness of the brush, as well as just it can get pretty gross over time. So it's good to do that often. Do brush after sweets. After you eat a bunch of sweets, that's when the tooth decay begins. So you want to brush. It's good to brush after you've eaten a lot of sugary foods. Let's go to the don'ts. Don't share your toothbrush. That's for obvious reasons. I wouldn't say that that's the most hygienic. Don't swallow toothpaste. I know there's some toothpaste for kids that are a little bit safer, in general, you shouldn't swallow it. It's not made to be ingested, so make sure you're spitting that out. And then don't forget to brush your tongue. Your tongue also holds different bacterias, and it's just good overall to clean the whole mouth as you can. And then also, obviously, don't brush aggressively, as that can cause damage to the gums. So we'll go into the actual techniques here in just a second. So let's go to the next. So let's actually go into the brushing technique. So they suggest that you brush at a 45-degree angle and in circular motion. And the picture here shows the different areas of where you should brush. You should brush the top and bottom exterior. Number 3 is brush the top and bottom interior. And then 4th is we're going to brush behind the upper and lower front teeth. That's where a lot of the calculus builds up, tartar and plaque buildup is. So it's good to do that. And then brush the chewing surfaces. So, right where the teeth contact each other. Those are the chewing surfaces. Now we're going to take a couple minutes right now to practice as a group. We've provided some brushes. We'll give you a couple minutes to do that. Okay, good job on practicing with the brushing. So let's go into the dentist. I know a lot of people get a little scared of the dentist and why. I think people, they put themselves in a worse spot with their teeth when they don't go see a dentist. And it's I think it'd be good to just kind of go over why we should, how often, what they do. So maybe you can go over some of the fears that some people generally have about visiting the dentist. So why do we visit the dentist? Well, it's essential for the maintenance of healthy teeth and gums. When you go there, they go over your whole mouth as far as your oral health, and they look for things that are going to potentially give you problems. So it's really important that you visit because they'll see things that you may not. So how often should you visit? Well, they say you should visit at least once to twice a year. I know that's probably a lot of people don't do that, but it's always good to do that, and it'll keep your mouth and teeth healthy. So what do they do? What to expect when you go to the dentist? So they're going to do typically three different types of things. They're going to do a head and neck examination. Basically, they're going to inspect your face, neck, your lymph nodes, your lower jaw. They're going to look for anything that looks off. Then they're going to go into the dental examination. They'll check your teeth, your gums. They'll maybe take some x-rays of your teeth just to see if there's anything that needs to be fixed there. And then they usually will do a dental cleaning. So they'll remove any plaque and tartar, and they'll polish your teeth. They'll floss it, make it nice and shiny. So that's basically what you're going to be doing when you visit the dentist, unless, of course, you're coming in to get a cavity filled or something like that. But just for a visit, that's typically what they're going to be doing. So there's really no fear of drills unless you know that there's a cavity and you're going in for that. But just to get a checkup, it's pretty basic and shouldn't be scared of going to that. So let's talk about our diet and sugar intake. Here's a list of some good foods we can eat that will help. They say to include cheeses, chicken, or other meats, because these foods provide calcium and phosphorus, which actually are helpful in repairing teeth. And they say to stay away from candies, cookies, cakes, pies, bananas, raisins, and other dried fruit, because a lot of these have a lot of amounts of sugar, and they also can stick to your teeth, which if you have something sticking to your teeth for a long period of time, it's going to start the tooth decay process. So you want to kind of stay away from things that are not going to come off your teeth easily. So in conclusion, just to recap, we talked about our brushing techniques. How early should you brush? How do you brush? We talked about visiting the dentist, kind of what they do, why we should do it, how often we should. And then we also talked about the diet and sugar intake and how we can choose good foods to help us. These are all good tips, and I would suggest that we don't just brush it away. These are things that are going to help you in the long run. They're going to help your kids in the long run, and it's good to start now so that they get a good habit of proper dental hygiene. So I'd like you to take a few minutes to set some goals over the things we talked about. And then if you guys want to learn more, we have a site at sites.google.com/view/tooth tips for kids if you're interested in learning more. But I would suggest that you take some time right now to set some goals and see how you can improve your dental health as well as your your kids. If you have any questions, please get with me after the workshop and be happy to answer them. Thank you for your time. Thanks for joining us, and hope you can improve your teeth and your kids' teeth moving forward. Thanks.